Good afternoon, everyone. My name is Susan Davis, and I have the privilege and honor of being the president and CEO of Sacred Heart Health Services. And I want to thank you all for this opportunity to be here today. But what I would ask all of us to do is to once again encourage and congratulate these role models in our community who are really our business leaders who have stepped up to the plate to create a healthy environment. So please join me in, again, thanking them. They really set the bar high for all of us. Mark and I are just going to try and, I think, there we go, summarize a few of the key points and what our next steps are in this initiative to create a healthy community and a healthy economic environment for our counties. I think we've heard many times today that poor health for our residents in both Escambia and Santa Rosa County is really not just a health issue, it's an economic issue. It's a quality of life issue. And every single one of you in this audience, I believe, feel that the health status of our county is not acceptable. Otherwise, you wouldn't be sitting here trying to figure out how we're going to make a change. So what I'd like to suggest to you is that it's everyone's responsibility to make improvement in health status a priority for the health status of our workers and our associates, but for the healthy economy of our community. And it's going to take all of us, churches, schools, large employers, small employers, which are the backbone of our community, all working together to achieve the improvements that we know we can for Escambia County. So how do you get involved? What do we need to do? What do we need to create to move this initiative forward as we know we can? First of all, become part of a collaborative event. There's going to be lots of opportunities. You'll hear about them after lunch. But become involved as part of a collaborative. Help develop a plan for our community and help us implement at least one initiative in your respective organizations and help us track our progress. We're going to do this again. We're going to do another health assessment in 3 to 5 years, and we don't want to see what happened this year with no improvement. Our county is in the bottom 25% of counties in the state of Florida, so we want to make it better, and we can by working together. Now, Mark is going to talk about the improvement compact that we have and that we need you to be a part of. So I'll turn it over to Mark.
Thank you, Susan. In your packet, you should be able to find this document. This is where that small actions, lots of people equals big changes. And this is the part where we're asking you to be involved in terms of making commitment. And in the packet, you'll find this compact. We're asking you to consider signing this on behalf of your respective organizations and to essentially volunteer to be a part of the solution. And we'll talk about what those solutions might look like. We'd ask that you return those or make that commitment by June 10th, a month from now, basically. And you can do that online at Partnership for a Healthy Community. Its website, or you can make that phone call. And all organizations at that time that make that commitment will actually receive public recognition as well. Again, trying to increase the momentum and awareness throughout our community. So please take those with you. Or certainly you're welcome to leave them on your table on the way out as we break up later today. Next steps in terms of what we're doing as organizations. Susan and I have had many conversations about our roles as major healthcare providers in our community, and we certainly are resourcing this with leadership through the Partnership of Healthy Communities. And so we will certainly be a part of these solutions. We'll help drive the momentum through the partnership as well. But it's going to appoint a steering committee. And that steering committee is going to monitor the progress of organizations that are a part of this compact. We're going to identify those health indicators we've talked about and track progress more consistently and make those data more public. We're going to work with specific work groups focusing on the big three: tobacco use, obesity, and overall health management of chronic conditions. And so from this, a committee will be appointed, work groups will be established, and be able to address results. So we're going to do some breakouts. So Susan, you're going to walk us through this? Okay, we're going to do some breakouts. We've heard from the panels, you guys, as Susan said, role model organizations. So we're going to break up after lunch, and we'll get some lunch instructions. After a healthy lunch, that's right. No bacon cheeseburger, sorry guys. And